All right,
You ready?
Mr. Ready.
Do I have to tell them anything about me?
You can.
Okay. Jane Oderberg. I am a licensed master social worker. I work primarily with caregivers of dementia patients here by an educational program and a support group. But most of my career, excuse me, 40 years, of which has been in various different settings with geriatric social work, long-term care, senior center, nonprofit organizations, assisted livings, et cetera, et cetera, et cetera. Next slide, please. So today we will learn how to communicate with frontline staff at the long-term care facility, become partners in caregiving, and family staff, resident and facility measures. Next slide, please. Thank you. Nursing assistants and activity professionals are the most important people for families to have a great relationship with in long-term care facilities. The families need to ask appropriate questions, just as the staff needs to ask appropriate questions so that they can learn about the resident, whether you're asking the resident themselves if they are able to respond, or if you're getting information from the families. And have a rapport with the CNAs and ask their opinions on issues of care. And share with them. I've always joked with my children to tell them to be sure whenever I'm put in long-term care, to be sure to tell them that I prefer a shower over a bath, and in the morning, not in the evening. Otherwise, I would probably get very upset. So they need to really learn a lot about the resident. Next slide, please. Staff should treat the caregiver families with respect just as much as the family should treat the facility caregivers with respect. I think education plays a huge part in that, because a lot of family members will come screaming and yelling about some perceived error that mom said. Well, mom's very demented and we're not quite sure what she said. And they're getting all up in the staff's face about it, when in fact it's not true. And then you try to educate the family about what the dementia is doing to that person. And, but they'll say, oh, my mother would never say that if it wasn't true. Well, yes, she might well, given the dementia diagnosis. Ask if they have time to talk about it, and then voice your concerns and express thanks to the staff for a job well done. Partners in Caregiving is a program that fosters positive relationships between families and staff through intensive training on effective communication, empathy development, and conflict resolution. The PIC program trains both families and staff, then guides families, staff, and facility administrators in a collaborative examination of facility procedures and policies that have an impact on staff-family interactions. The family measures, you can use the interpersonal conflicts scale. There is also a staff provision to residence scale, staff empathy scale, nursing home hassle scale. I just like the name of that, so I put that up there. And the Zaret burden interview that caregivers have to take. Our families come with a ton of baggage, not suitcase variety, but rather trunks full of stuff conflict within the family, perceived failure because they couldn't keep the person at home and take care of them at home. And now they've had to turn it over to the professionals rather than doing what their mother did in taking care of her parents, having them in the home, and it was just impossible to do. Staff measures would include an interpersonal conflict scale using the family instead of staff. It's very similar. Family behavior scale, the family empathy scale, and the Maslow burnout inventory. Very interesting results from that. And generic job satisfaction scale. And residents also have some measures to check. The Cohen-Mansfield agitation inventory, which for many dementia patients, agitation is the means of expression when they can't find the words. And the Werner Cohen-Mansfield, and the number of family programs and whether specialized training for the staff working with family members, and checking the nursing and CNA turnover rates is very important as well. I think families come into a facility with preconceived notions, or else they think that it's like how many facilities were back in the day. When I moved to Fort Worth 47 years ago, there was no assisted living. There was no retirement option. If you were in the hospital, you went straight to a nursing facility. There weren't specialized rehab hospitals. And some of those nursing facilities were pretty darn awful. They weren't what you would want, but there wasn't any other alternative at the time. You weren't getting PT or OT or speech at home. And so nursing homes got a bad rap for a long time. I think that those of us who work with geriatrics need a good PR agent to let family members know what we do, why we do it, and how well we perform our jobs. Interpersonal conflict is a prevalent workplace problem associated with numerous adverse consequences for both employees, depression and negative affect, and organizations, turnover and reduced productivity. The 6-item workplace interpersonal conflict scale is a valid measure of workplace interpersonal conflict related to many other workplace variables in the domains of work, health, and safety. Next slide. Population-based study of the relationship between stresses or hassles and burnout of 30 family caregivers and institutionalized older adults. Burnout measure, patient hassle scale, which is cognitive, behavioral, and ADLs, and nursing home hassle scale, caregiver to staff ratio, resident to staff, and logistics. It was found that these hassles correlated to burnout for both the staff and the caregivers. Person-centered communication in dementia care. Communication involves an exchange of information between two people, a giver and a receiver. Poor communication may result in high anxiety and depression for the person living with dementia. Communication breakdown contributes to high rates of depression of spouses and those living with dementia and is a major problem for family and carers. Positive and supportive communication is essential to ensure good quality dementia care. Person-centered communication involves a commitment to including the perspective of the person with dementia and understanding who the person is, life history, and preferences. It's really, really important to learn about what the person, when they're first coming into your facility, what the person needed to know, wants you to know, or what the family wants you to know. It could be something as simple as a favorite breakfast cereal that is not included in the usual regimen in the kitchen, and that the dietary supervisor went to the grocery store and bought it. So this woman would feel heard about what she had requested. That I did I not? Okay.
That's good.
And these are the key points of the burnout self-test. 15 statements to answer, ranging from not at all to very often. Total scores range from 15 to 18 is no sign of burnout, to 60 to 75, very severe risk. And there's the website for that. And the Cohen-Mansfield Agitation Inventory, which is useful to assess the residents' agitation. There are 29 different items and 4 separate categories. And then the Zaret, which is useful to evaluate the caregiver experiences and the state of their physical and mental health.
Well, thank you, Jane. Are there any questions or clarifying questions or comments at this point?
So we move on to Suzanne.
Susie.
Susie, excuse me. Susie is going to do improving patient-centered dementia care, communicating with families along the same lines. So we will start with that.
Great, thanks so much. Good morning, everyone. It's great to be reconnected with you all this week. So today we're just going to continue the conversation about improving person-centered dementia care. And we're really going to focus on improving communication, both with providers as well as with family members. So let's go ahead and go to the next slide. So in terms of our objectives for today, we're just going to talk through some of the challenges with effective communication. We're going to discuss the role and the important role, actually, of communication in resident and family-centered care. I'm going to sort of walk through and discuss an approach to improve provider communication, and this is centered around persons having dementia. And then finally, we're going to talk about improving resident and family engagement and sort of how do you do that? And we'll share a couple of examples there. So let's go ahead and go to the next slide, please. So in terms of challenges in communication, really the take-home message here is that it is not easy. I think we all know that, on a good day, it's pretty challenging to have great communication, both internally within a nursing home, as well as with our families and loved ones, maybe friends. And I think this is really one of those spaces that has been made more challenging with COVID on the scene, having to do things remotely. We're having some staffing challenges and things like that. So there are challenges related to the nursing home, as well as familial challenges that we just, really kind of want to be aware of. So these are things like staff-related elements. So if we're understaffed, if there's turnover in staff, or just in general, I think when we're all busy, which I think we all are, it's really hard to have great communication among our staff. So all of these things really sort of lead to challenges in terms of effectively communicating with families. And then conversely, on the familial side, our families are managing through many things. So they often have some feelings of guilt that they're working through. They may feel like they don't have enough information about what's going on. There are also some psychosocial factors that are going on. They may not feel like they have enough time or enough space to talk to our team members. So again, this all just sort of snowballs into a situation where, good communication is challenging, and we really need to work toward having good communication. So on the next slide, we're going to talk a little bit about the role of communication. And this is really focused on resident and family-centered care, which we've talked about in a couple of sessions before. So this is nothing really new, but as we continue to shift our mindset to resident-centered care, we really want to have some sort of distinct ways to identify resident preferences. These may include past patterns, and this will really help us to guide the decisions that are made in terms of caring for the resident. And so really ultimately, the whole point here is that we want to improve the resident's quality of life. And again, this is just really, really important when caring for patients with dementia. Okay, so let's go ahead and go to the next slide, please. Okay, so we're going to get into sort of the how do we do this. Again, like I said, it's challenging, it's complicated, it's something we have to focus on all the time. And so this is a great study around improving provider communications with residents that have dementia. And Jane talked a little bit about this before, but this is a study that was in the American Journal of Alzheimer's Disease, and there's a few elements in this that I really like. So first, this was a multifactorial intervention, which sounds super complicated, but it's essentially an intervention that has three pieces. The first piece is developing an individualized communication plan. And in this study, that communication plan was done by a speech and language pathologist. But basically, this was just a way to gather some information that would then be integrated into a communication care plan. And so this included some key elements like how to effectively communicate with the resident, how the resident may communicate with others, provided an explanation of the resident's behaviors and habits, and some of those other sort of softer things that may just help improve communication and improve the interaction. So that's kind of the central piece of this intervention. Additionally, there was a 4-hour dementia care workshop that was developed, and this was developed and delivered to all participating care providers. And so this really kind of included the sort of how to share communication plans and sort of what that looks like and how to use it. And then finally, the last component was supporting the implementation of these communication plans. And so this included having a support system for the care providers as they were carrying out the communication plans. So in this study, it was an advanced practice nurse, and that person met weekly with the care planners to really review and assist with the implementation of the communication plan until it kind of became sort of part of the process. So the element that I really like about this intervention is that not only did the residents experience an increase in their overall quality of life, but also the providers really noted a significant improvement in mood as well as perceived reduced burden in terms of caring for the folks. So I think it's that rising tide raises all boats saying, and that, we really want to improve the quality of life for our residents while also, reducing the burden on our providers. So I just wanted to share that with you all. It's a great study. If you have a chance to take a look at it, really provides some good ideas. Okay, so let's go ahead and go to the next slide. And here we're going to focus a little bit more on how to engage families and sort of thinking about this as another piece of the puzzle. And so this is a really great thing to do. Again, it is a little bit challenging. And so globally, we really just want to think about establishing a positive relationship from the beginning. So always kind of focusing on the needs of the resident as well as the needs of the family. And so how do we do this? We really want to think about encouraging participation of the family in all decisions as appropriate. And, again, this is a little bit resident specific, but depending kind of on how the family wants to be involved. But really thinking about involving them, no matter how big or how small the decisions may be. And then always just making sure that we're communicating and sort of living through the message that resident and family-centered care is a priority. So on the next couple of slides, we're going to cover a couple of ways to do this. So the next slide is a healthcare team tool. And this is available from AHRQ, and it is a great tool that can be used to establish really the foundation of a positive relationship when that resident is first admitted to the nursing home. And so this tool really is something that you can give the families or the friends or the loved ones. And it just gives sort of a one-stop shop for explaining all of the roles and responsibilities of the team. It really defines the healthcare team. But the piece that I really love about this is that it includes both the resident as well as family and friends in that overall healthcare team. So you might be using something very similar to this already, but again, this is a tool that can really easily be duplicated. Again, sort of the key here is that it's setting the expectation that the care is really resident-centered from the beginning. And so on the next slide, we're going to talk a little bit about care planning. And so this might be something that you're doing already, but really encouraging ways that the family or the resident in certain situations can be involved in care planning. So this is just a great way to really understand and assess the resident's preferences. We always want to make sure that we're listening for the needs and preferences. Sometimes we're observing the needs and preferences of the residents and their families, and just making sure that we're always documenting those preferences in the care plan so that other folks who may be covering or who may be taking care of the resident are doing those same things as well. Okay, so on the next slide, we're going to talk a little bit about improving patient-centered family engagement. And so as you begin to sort of think about your current processes and think about what you all are doing, you might want to just ask yourself, for maybe your coffee team or your administrative team, some of these questions. And this will help you to identify potential areas for opportunities. And so some of the key things that you see on the screen here are to consider, how you're currently engaging families. Are they providing resident-centered feedback? Are you identifying opportunities that families can do this? And I think a key piece of this is really making sure that they're hardwired into your processes. I think our lives are pretty complicated right now. I think we're all very busy right now. So I think this is something that's really easy to get away from, but really trying to get out in front of it and be a little bit more proactive rather than sort of waiting for when there are challenges with the residents' care is, I think, kind of the key to this. And then finally, thinking about how you can identify one way to improve family engagement within your home or your organization. Again, I like to focus on just trying to fix one thing. I often try to fix many things, and then I just get super frustrated because I can't change them all at once. So really kind of thinking about which one is the most important to change and focusing on change in that area. Okay, so on the next slide, we just have a few key points in closing. So for me, I think it's really important to have a hardwired process just to make sure that this doesn't fall through the cracks. Like I said, we're all busy, and again, this is really challenging. So in my experience, that was really kind of the only way that I could make sure that it happened. So just making sure that we have an approach to give family members as well as the residents sort of their time and space that they can provide feedback. Making sure they have an opportunity to always help us improve the quality of life for the resident. Again, not only does this improve the quality of life for the resident, but it can also reduce burden on our staff. And then always just making sure that we're actively listening and integrating that great feedback or suggestions or recommendations into the overall care plan. Okay, so with that, on the next slide are some references. And again, all the tools and information that I shared today are located in these references. And with that, I think that's all I have for you all today. So I will go ahead, turn it back over to the planning team and Barbara for any additional discussion questions. And then I think we're going to move to breakout sessions. So thanks, everybody. I enjoyed being with you today.